Let's talk about diabetic retinopathy. Retinopathy is an eye condition wherein the back side of the layer of the eye is affected because of uncontrolled blood sugar. As we all know, Goa is considered the capital of diabetes, and there have been rise in the number of cases of diabetic retinopathy. Since retina is a important tissue of the eye, if damage caused to the retina, it can be irreversible, which can lead to permanent blindness. If you consider diabetic retinopathy, it has various stages. It can go from non-proliferative to proliferative stage. So in proliferative stage of diabetic retinopathy is the more dangerous stage, wherein there can be growth of abnormal blood vessels over the retina. These blood vessels can bleed, giving rise to sudden loss in the vision of the patient, and it can also give rise to traction on the retina, giving rise to retinal detachment. Early stages of diabetes can be managed with control of blood sugar. If you have high blood pressure and high cholesterol, then also it increases your risk of getting diabetic retinopathy. So you have to control your blood sugar as well as your blood pressure and cholesterol to get your diabetes under control and to prevent diabetic retinopathy. Pregnancy is another risk factor which can give rise to rapid progression in diabetic retinopathy. Now, in diabetic retinopathy, there are various stages, as I told you. One of the stages, there can be swelling in the retinal layers. So, if there is any swelling, which we call as macular edema, you may have to need intravitreal injections and even the need of retinal lasers. In advanced cases of diabetic retinopathy, you may need surgery. Hence, it is very important to get your eyes checked regularly if you have diabetes. In case you have been newly detected of diabetes, then get your eyes and retina examination done at the earliest. And if you are already taking diabetic treatment for a long time, then annual checkup of retina examination is more than enough to detect early changes of diabetic retinopathy and to carry out the treatment for your eyes. Thank you.